When we talk about breast cancer care, when we look at all fields in cancer, breast cancer changes the most and the fastest. That's a good thing, and it makes it a little bit more difficult also. The good part of it is that there are constant advances in this field. The research that goes into and has been poured into breast cancer really is a game changer, and it's why we have the statistics of survival that we do right now. Every year since the 90s, the death rate from breast cancer has decreased 2%. Doesn't sound like a big number, but the number of breast cancer patients is so large that 2% really adds up. And if that's your mother or your sister or your grandmother or your best friend, that really matters. At Nuvance Health, we offer the most advanced cancer care that one can get.
Breast medical oncologists specialize in treating breast cancers with systemic treatments, meaning chemotherapy, hormonal therapy, immunotherapy, targeted therapy. And the purpose of treating with systemic treatments is really to, one, decrease the risk of breast cancer recurrence, meaning breast cancer from coming back, as well as, unfortunately for those with metastatic disease, cancer that has spread elsewhere, it's meant to control or stabilize their disease so that people can live longer with their disease as well as with a good quality of life. A top concern that patients might have after completing treatment is the concern for breast cancer recurrence or breast cancer coming back, especially elsewhere in the body. And so it's important for those people to know that you need to continue with your routine breast cancer surveillance that includes breast clinical exams through the medical oncologist as well as with the breast surgeon, as well as routine breast imaging, and that includes mammograms, sometimes ultrasounds, as well as MRIs. It's important that when we provide breast cancer care for our patients, that we approach it in a multidisciplinary fashion, meaning that we as medical oncologists work together with the breast surgeon as well as the radiation oncologist in order to provide a treatment strategy for that particular person. We know that all breast cancers are different from one another. We know that each person, each individual has differences, meaning different comorbidities, different goals in terms of their care. And so it's important that we individualize each treatment plan together for that patient. And so medical oncologists work together with the other specialists in doing that.